about PACT, Parents and Children Together. This intervention was developed by Carolyn Bowen and Linda Couples, and it is a family-centered phonological approach that requires active participation from the child, the parent, and of course the SLP. It targets speech perception and intelligibility in children with phonological disorders, and this leads us to our target population, which are children ages 3 to 6 who have phonological disorders and are backed by a lot of family support, as this intervention requires parent involvement to a high degree. We're going to get into the details before we get into the details of the approach, let's talk about some theories behind it. First being the phonological theory. This branches from the theory of normal phonological development, namely natural phonology. And this states that children simplify adult speech sounds using natural processes. And then family systems theory states the importance of viewing the family as a whole, as an interconnected system rather than individual parts. And then before treatment, we'll be doing a few things. We'll be doing a hearing screening to make sure that the child can hear and that nothing will impede treatment. And then we are going to administer a quick screener. This is a single word screener, and it's kind of interesting because the parents will actually watch the testing and the independent analysis of the child's speech to help them understand their own child's speech and the nature of phonology. And then we are going to select the targets based on that screener. And there are a few criteria, which include sounds that are not stimulable, later developing, and that are consistently aired on. And all these targets are very flexible. Moving on to the foundations of therapy. This involves the modification of sound airs and the emphasis on feature contrast. So that's talking about minimal pairs. And that is kind of what this approach focuses on during treatment. Just differing between that one phoneme. And then salient contrast is where it is easier for children to decipher. Salient contrasts are where, I'm blanking, one sec. Salient contrasts are still blanking. Salient contrast is when the more different the sounds are, the easier it is to understand for children, whereas if sounds are similar, it might be more confusing. Sorry, that took me a second. Okay, and then the 5 components of PACT. This includes parent training, where the parents are taught different techniques such as modeling, recasting, self-correction, just things like that they're going to use with the child. And then metalinguistic training, where the three, the SLP, the parent, and the child talk and think about speech sounds through games and activities that involve sound picture association, awareness of rhymes, and playing with lexical and grammatical units. And that is just to name a few. And then third, the phonetic production training. This is where the SLP actually teaches the child how to make the sounds they're having difficulty with, and the parents work with the child at home. Then the multiple exemplar training. This is kind of the, activities, and this is where the parent and therapist read a word list to the child, and they learn to sort the words or picture cards according to their sound properties. And some of these activities include point to the one I say, or put the rhyming words with these words. So kind of categorizing and just really paying attention to the sounds of words. And then lastly, homework. This is where parents perform the activities I just listed with the child 5 to 7 minutes, at least 1 to 3 times a day. And these are based off of therapy activities that were previously done in the sessions. And then finally, getting into the session details, which consists of one 50-minute session weekly, and of that 50 minutes, 30 to 40 minutes is spent with the child and the SLP. And then 20 minutes is with the parent present, so the addition of the parent. In that 20 minutes, it can either be at the end of the session, or it can be 10 minutes at the start and 10 minutes at the end, just depending on the therapist and the parent's perspective. Okay, and then this intervention is actually pretty interesting, as it involves series of blocks and breaks. So usually the first block is a 10-week time frame, followed by a 10-week break. And a block is when therapy is occurring, and a break is when therapy is not. And the length of blocks tend to decrease as needed, but breaks stay the same at 10 weeks. So blocks can decrease from 10, 9, 8, or however is needed for that child. And then during breaks, parents will actually not do any formal practice for 8 weeks, and then 2 weeks before the next block, parents are asked to start on activities again, using the strategies they've learned and the techniques to elicit the targets. Okay, and then one last tidbit is that the quick screener can actually be used multiple times. So I think the source that I read is that it could actually be used as like a progress monitor to be done like after a series of blocks and breaks, just to make sure that there is progress being made and that intervention does not need to be changed. Okay, and that is it for parent and child together. Thank you.